Hello there and welcome back to Under the Dome from Town Meeting TV. My name is Bobby Lucier. We're talking today about healthcare and we've just finished. This session is just adjourned as of last Friday and we have a lot to discuss. Our legislators have been really busy this session and healthcare, of course, is a topic that sprawls across many different committees and regions. So we are joined today by Senators Martine LaRocque-Ulick and Senator Ginny Lyons. Thank you both so much for coming in.
Thanks for having us.
Awesome. So maybe we'll start with just some introductions and backgrounds. If both of you can just share what committees you serve on as senators, right? And then what districts you represent and what brings you to the legislature. Why do you serve in the legislature? Maybe we'll start with you, Senator Lyons.
Oh, thanks, Bobby, and thanks for having us. And I just want to say thank you to Channel 17. You're always so really important to all of us in communicating with the community. So, Bill, thanks for having us. As you said, I'm in the Senate, and I have served now this is my 12th session, and each session is a new experience, and it's a new opportunity to accomplish some of the goals that we all hold dear. I serve as chair of Senate Health and Welfare in the Senate, and also on Senate Appropriations. And then on other committees, we all get appointed to other committees. So the Rules Committee, Joint Justice Oversight, and I also chair the Health Reform Oversight Committee. So there are a lot of responsibilities that we each have when we are in the Senate. I look forward to continuing work. So I know we're not talking about that today, but certainly we've just begun to scratch the surface on some critical issues this year. And I look forward to talking about them with you and Martine.
Lots to talk about. Martine?
Thanks, Bobby. So my name is Martine LaRocque-Ulick. I live here in Burlington, and I serve on the Burlington School Board, have for 6 years, going on 7. And my two committees in the morning, I am on Health and Welfare with the chair of the committee, Senator Lyons, who has become my de facto mentor, whether she knows it or not, but she has really helped me navigate being a first-term senator. She's been amazingly helpful. And in the afternoon, I am the vice chair of Senate Education, and it's been really interesting for me to see the connection between those two committees and those two bodies of work. Education and healthcare sort of cross paths in many, many different areas. So working on both of those committees for me was absolutely fascinating. And it's really about systems that help people live healthy lives, right, in various ways, whether it's through education or through healthcare and wellness. So the two of those together really made for very interesting two sessions in the legislature.
Yeah, well, maybe we can start there. Two topics that are on top of mind for so many of us, healthcare and education, and the interrelation between the two. I think the topic that has been discussed most this session is around budgets and how the increase in our school budgets as well as our municipal budgets are largely driven.
And I don't view healthcare as a commodity. I view it as a public good. And so it becomes really difficult when you start talking about inflation and healthcare. At the same time, we know that all of our healthcare providers, our hospitals, our docs, and then our insurance companies all have certain demands on them as a result of inflation. So it gets to be a challenge for us. One of the places where we see significant pressure on increased costs, and this has been a way now for several years, it's on the cost of prescription drugs. And as we essentially have little or no control on the cost of prescription drugs. So to that, this year, we did make some significant progress. I think at least it's a significant beginning. Two bills, one on what's known as PBMs, that are really corporations that control drug costs. But the other is in the area in our state. We've initiated a prescription drug advisory board within the Green Mountain Care Board to set upper price limits for drugs, but at the same time ensuring that folks can get their brand name drugs, that not everything will become generic. So that's one place where I think our oversight and control of costs is going to be so important. We won't see the results of this legislation for at least 2 or 3 years. We do know that we're consistent with some other states like Maryland or Colorado or Oregon, where they're also putting in place a regulatory board for prescription drug costs. So I see that as a real opportunity for us in this state. And then, as I said before, the PBM bill that was passed, and I think you talked about it with some of the House members who are in here earlier. The pricing of prescription drugs is truly a black box, and it's putting significant pressure on some of our smaller pharmacies. It's really extremely upsetting. And the bill that we passed and that Senator Martine reported on the floor of the Senate, I think, is another a good beginning at transparency. In the past, I worked with the National Association of Health Policy folks when we passed our importation bill. And what we haven't done in our state, we allowed for in our legislation, we allowed for our administration to negotiate with the federal government for the importation of lower cost drugs from Canada. We haven't done that yet. Florida has now done it and sort of beat us to the punch, but that's another important thing that we can do and work on that. The other is that we have removed gag orders so that pharmacists can now talk with patients when they come in for their prescription drugs and help them find lower cost drugs when they get them. So I'll stop there, but we are working in this area, and we would like to see we'd like to see faster changes, but we know it's really difficult to have the Titanic move away from the iceberg, and we're working as hard as we can to do that.
Right. Yeah. Senator Gulick,
Yeah, I wanted to add to what Senator Lyons was saying about the pharmacy benefit managers, which was one thing that we learned as we were digging into the work, was that around 10 years ago, a little more than 10 years ago, we had 35 local small pharmacies. We are down to 18 right now, and from what we heard in testimony, they're barely holding on. So this work is incredibly important. Local pharmacies, especially in rural areas, they are, to a certain extent, healthcare providers and healthcare. They're part of the healthcare ecosystem. They get to know families. They get to know, for generations, for decades, they're communicating with folks and treating them and listening to their stories and health stories. And so it's really critical that we maintain those small pharmacies, especially in rural parts of the state. So I just wanted to highlight that as the pharmacy benefit manager piece. But getting back to taxes, and it's such a hot topic right now, I was here, a couple months ago talking to you about school budgets. And that's still at play at this very moment. One of the things that we learned, I mentioned a few months ago, and I'll mention it again, is that healthcare costs were a big part of the driving up of our education costs as a state. I believe it was around 16.7% increase. So that is substantial, and that is having a huge effect on ed funding, which ultimately ends up as part of our property tax bill. So it's important for folks to see the interconnectedness of all of this. These are not silos. And as I said earlier, education and healthcare, they meet in many different ways, and that's one of them. Yeah.
So maybe anything more to add on the prescription drug side of things, or ways to lower healthcare costs before we move on to the opioid?
Well, I think one of the ways that we've reduced costs, and we'll hopefully see the benefit of the bill that we passed on prior authorization. It's been devastating to our care providers, hospitals, independent clinics, and larger clinics, to have this huge administrative burden for prior authorization. In other words, when you go in to see your physician or your PA or advanced practice nurse or whomever, your care provider, and then before you can receive treatment, the insurance company may have to give the okay. And what we have learned from our providers across the board is that they've had to hire people to make all those phone calls, and sometimes the phone calls go on and on, not just for a day, but a week. We heard in one instance that care was delayed for 6 months. And then we heard in another instance that an individual, rather than having the prescribed treatment from her provider, had to go to the emergency department. Well, that increased costs, doesn't it? So increasing costs by having to hire someone to do the paperwork for prior authorization, or hire someone to sit on a phone and say, is it okay to provide this treatment for a patient? Will it be covered by your insurance? That's extremely costly. So if as this bill goes forward, and hopefully the governor will sign it, then we'll see the benefit of having reduced administrative burden for folks. So that's just another area of concern that we've had.
Right. So prior authorization, this is something that there have been, I think, a couple of concerns that I've seen around this potentially, that claims that this might raise insurance premiums. Can either of you speak to that? Will this make insurance more expensive?
Well, the way that we ended up on the bill, we reduced the prior authorization, taking away prior authorization for primary care only. So that will have less of an effect, if any, on insurance companies. The insurance companies are not pleased with this, obviously, because it's their regulatory oversight. And yet, where this has happened in other places, we haven't seen an increase in cost. So I can't speak for the insurance companies. They did say it would cost a lot of money. We saw some descriptions of what it might be, but there really wasn't a full actuarial analysis of the implications. I do know that what we've seen from our local providers and especially our smaller hospitals is that there will be a reduction in paperwork and more attention given to patient care.
Right. Senator Gulick, your thoughts on the prior authorization bill, if you
what I was going to speak to was, just as I look at all of these bills that I wrote on my little cheat sheet, I was thinking about how, this whole, taken as a whole, all of this work together, you want to see the fruit of your labor over decades to come. And we don't necessarily have a number, but I know we're going to be talking about S18, the flavored tobacco bill. The best way to lower costs, right, is for us to all be healthy as best we can, and staying away from tobacco is one way. But I'm even looking at my doula services, the doula services bill, Medicaid coverage for doula services, which is S109. So, you've got coverage for some of our most vulnerable folks at the beginning of life. Doulas come in and they help a family or an individual pre-birth, during birth, no matter how long that is, and then after the fact, postpartum. So what this doula service will do ultimately is provide a safe and healthy start for a child in the state of Vermont. That pays dividends over the long run in ways that are hard to quantify, but are real nonetheless. So it's not always easy to point to something and say, this is going to cost X amount of dollars, but we know that it's going to improve health outcomes, which will ultimately save money in the system. So I did want to just mention that as something we're doing, and I'm sure Senator Lyons will want to talk about S18, which again is, big dollars.
Yeah, so let's talk about S18. So this was a bill that was vetoed by the governor. So Senator Lyons, do you want to talk about what this bill would have done?
Yes, this is S18 is the bill that would have eliminated flavors from vaping as well as menthol tobacco, understanding that all tobacco products currently have menthol in them. And we also know that the attractiveness of vaping to kids is because of the flavors. Mm-hmm. We also know that our large tobacco companies are advertising big time to youth, to LGBTQ, and to our black populations. So the result is if those populations have increased the uptake in the purchase of flavored vapes, of menthol tobacco products, and we're seeing an epidemic of use amongst these folks. And we're also seeing higher incidences, for example, of cardiovascular disease in the black population. All of which to say is that, and then we had kids coming in from Lyndonville, we had kids coming in from Burlington, we had kids coming in from CVU, talking about how really dire the use of vaping is in schools. Put all of that together and you say, well, what are we doing to prevent nicotine addiction? And if we can eliminate these flavors for kids for access, the way Massachusetts has done, the way New York City has done, if we can do that, we prevent the onset of some pretty devastating chronic diseases later in life, and we reduce healthcare costs because we're reducing all those expenditures for chronic illness. So S18 was the bill that we put in. There was a lot of misinformation out there, and we can talk about that as you would like. And Martine certainly could, talk about some of the mythology around menthol. But we put the bill in. We passed it last year over to the House, and then it came back to us late this year, somewhere in March, I think. And then we sent it to the governor, who promptly vetoed it. It was really disappointing.
What was the vote in the Senate? Do you remember?
Oh, golly. It was like 16 or 18 to something.
Pretty close.
It was I think we could have, we could probably have found 2 or 4 more votes. But the leadership decided that we would hold off. I'm certain that we will be coming back to this issue in the future. And I'll let Martine talk a little bit about it. She was the one who reported it on the floor.
Yeah, I just want to say, it was disappointing that the governor vetoed this bill for sure. Especially, I was a high school teacher, so I was like on the ground with the vaping, the start of the flavored vapes, and I sort of lived through it. It was, it's nefarious. It really is the way big tobacco and corporate America manipulate children and get them hooked on nicotine at an early age. And a few of the things that we learned in committee, for example, those cartridges that are part of the vape product, how the nicotine in those are, packs of cigarettes. Like you're getting in just a few inhalations, you're getting the amount of nicotine that you would get like in a whole pack. I mean, it's just really devastating. And then menthol, I don't want to get into the science and the biology of it, but just how menthol really allows the body to absorb more nicotine. Mm-hmm. So again, it's kind of like a conduit to more poison, frankly. So those were both very unsettling things that we learned. We all got bombarded by emails, which were all, I'm sure, part of a campaign that was orchestrated and well organized. And I say to people, we're not taking away your ability to smoke. This was really a targeted effort. Young people, flavored vapes, trying to get them out of schools. We know that schools are already struggling with staffing issues. We know that there are behaviors coming out of the pandemic that are very difficult to manage, and vaping has just exacerbated all of that. So we tried, we did what we could to make a dent in this, but unfortunately at this moment it's, we'll see what happens. But
Right. What's a couple of the biggest sort of challenges in terms of like why wasn't this why wasn't an override pursued on this bill?
I mean, this is just my perspective. I can't speak for Senator Lyons, but it does seem that we heard from a lot of our local mom and pop stores. We heard a lot from a lot of folks who said they really rely on the sale of these vape products to stay in business, and they were very passionate and persistent. And I think as legislators, we are often swayed by our constituency, as to a certain extent as we should be, and yet there are a lot of realities out there that we have to take in at the same time. So.
Yeah, so, and just along those lines, we did hear testimony in the Senate that the smaller stores would die because of loss of tobacco or vape sales. So that's even more disconcerting when you think about it. And the big issue, as I said before, and I think that Senator Gulick was referencing, is the sort of the mythology about menthol and so on. Some people say, well, menthol helps me quit, and there's absolutely no research demonstrating that. It does make the tobacco feel better when it goes down because it's, menthol is very soothing. So even the people who in the State House who were smoking in the legislature were against banning menthol. So I sort of question what would have happened if we'd left menthol in, but at the same time, menthol is, as Senator Gulick has said, Martinez said, it does increase the uptake of nicotine, and it makes the addiction that much worse. So we've got a generation of kids who are now addicted to nicotine, and once they don't have enough nicotine, what's next? That's very concerning.
And so one last point I just wanted to make, because Senator Lyons mentioned mythology. We did take testimony, and we did hear in our committee that if you look at some of the surrounding states, for example, Massachusetts, because they did do this, they did ban flavored vapes, and they didn't see an apocalyptic closure of small mom and pop stores. So that
they saw an increase.
Yeah, I mean, it just didn't bear out. So it's confusing. The emails we got just don't quite square with what we learned from Massachusetts at all.
Right. Yeah. Let's return back to the conversation about healthcare costs for a second. I know there was a big bill that was passed in the House that was aiming to expand Medicaid and Dr. Dinosaur, and this was an effort that would have established some pretty significant new revenue streams. And so I understand this has now been implemented into the state budget, but to a lesser degree. Could we talk a little bit about what the legislature has done to expand Medicaid this session? I don't know which of you would want to start on that.
I'll let Senator Lyons go on that.
Sure, I'm glad to do that. The bill actually came from an access and affordability working group that I chaired session before last, and we worked very hard. We had a consultant who looked at different places where we could intervene and improve healthcare access and affordability. So that was the access and affordability report. In that report was a suggestion for increasing the Medicare savings program. Was also a suggestion in there for expanding Medicare for Dr. Dinosaur, in particular for young people up to the age of 26, everyone. Mm-hmm. And then a recommendation for expanding Dr. Dinosaur for pregnant women. Mm-hmm. So our committee looked at the bill that came to us from the House. The benefit would have been fairly small, and there's no way. So if you had, let's say you have 600 or 700 people in that age range who you might say could need insurance, but there's no way of knowing. Their parents insurance until they're 26. So some of those questions were not answerable to us. So we decided to let that one sit until next year. We did look at the expansion for pregnant women, and we did recommend that to the Senate Appropriations Committee. We also recommended expanding the Medicare Savings Program to help folks. We went a little above 145% of poverty, and when it got to the Appropriations Committee, it landed on 145% of poverty, which means that someone who is on Medicare, who earns about $1,200 a month, it's like $20,000 to $24,000 a year, in that range, would be eligible for some supplemental support from the state. We did pass that it is in the budget. So we did do that part of the bill. We considered Medicaid expansion, but as I said, we are in a year where we might have some money to support expansion, but we would be left with some really tough decisions next year. So we didn't do that this time, but it's still there. There's no reason why we can't come back to it.
Well, this was one of a few bills, if I recall, that there was a big housing bill, and then there was a big judiciary expansion bill, and they all, if I recall, had revenue mechanisms attached to them around corporate taxes or increased property transfer taxes and income taxes, and it seemed like the Senate didn't have as much of an appetite as the House did for those taxes. Can you speak to that at all?
Yes, I can. So typically when you write a budget, the way the budget is written, you get a budget proposal from the administration. So the governor proposes how to spend the revenue of the state. The legislature also is passing bills that may have budgetary implications. Traditionally, what we've done is we've passed those bills. They go into appropriations. Appropriations takes out the appropriation and then waits to the end of the session, or as we're developing the budget. At the same time, when we need that money, it's the Finance or the Ways and Means Committee responsibility for determining how best to raise the funds. What the House did this year was to include not just the policy and the need for increased funding, appropriations, but they also included where the money would come from. So when you're talking about the corporate taxes and other increases in taxes, like sugar beverages, sugary food taxes, those things, those were embedded into bills as the House passed them. Right. So it made it really difficult for us in the Senate to look at a bill and then also coordinate that with the budget and the revenue process. It does get complicated. If you start out and you have, and I'll speak from my perspective on Senate appropriations, if every committee in the Senate was allowed to, and the House was allowed to say, okay, these are the things we want, and we're passing not just the policy, but then the appropriation, and then also the revenue, we would end up with, how many committees are there? 20 committees putting in their priorities, and then the Appropriations Committee would have to sort out how do we prioritize all these policy recommendations. So it gets to be complicated. Right. And in health and welfare, Martine and I have a saying that is, it's more complicated than that. Mm-hmm. So I'm not sure that, so the bills that we passed out of our committee on emergency temporary shelter, we worked very hard on that, and we can talk about that in a bit if you'd like. But it also did go to appropriations, and eventually sorting things out with, we know the good policy that we want, but how can we afford it, and how much of each of those things can we afford? That's a determination by the appropriations committees and the finance or ways and means committees. The policy committees should be saying, these are the best policies for us as a state. So we would like to see a Medicare savings program, or we would like to see a general assistance housing, temporary emergency housing for folks. How can we get the maximum out of the revenue that's coming into the state? And what do we need to raise more funds to make this happen? So those are a lot of very important questions that we ask collaboratively and collectively. One policy committee doesn't make all the decisions on each of those things.
Right. Senator Gulick, do you have thoughts on some of these spending bills as they came to the Senate from the House, and how, I mean, I think there is this question, right? I think Senator Lyons, you're bringing up that the process this year was unusual that the House took to introduce some of this spending, and also there is this question of, you know, whether the Senate has an appetite for some of the actual tax mechanisms that were being introduced. And so is there also concern there around, in the Senate, not raising some of these taxes in such a significant way as the House passed them?
I mean, I defer to my senior, I think I can say that, my senior colleague who has been in the Senate for a while and is on the Appropriations Committee. Her knowledge is definitely much deeper, and just, you know, she's been at it longer. So I don't want to make comments that might be erroneous, and I would certainly defer to Senator Lyons on that.
Well, but let me just say something about that. It has been really important to have folks like Martine on committee because she gets it. She understands where the healthcare needs are or the policy needs are, whether it's housing or education in our districts, and our districts bump into one another. But she truly understands those things, as do some of the other folks who may be less experienced in the Senate. And so the perspective that Martine brings is critical to our decision making. And the budget process is not something you learn overnight. We talk about base funding, we talk about one-time appropriations, we talk about special funds. There are a lot of different elements, and those are the simple ones to bring up. But there are a lot of different elements to writing the budget and then deciding how do we raise the money that we need to do what we would like, and where do we get it? And a lot of people don't like raising taxes, so if you're not going to do that, then you don't move forward on some of the policies that are suggested.
So you didn't support, for example, the $500,000 increased income tax. Is that not something that you would be comfortable moving forward with?
Which 500,000?
I think there was a high income
that one.
tax. I think it was attached to a different bill.
Yeah, so that never got to us.
Okay.
It was that was decided in Senate Finance.
Okay.
Yeah, but you know, if we can, in a year where taxation on everyone is challenging people's incomes, it's tough. However, I can remember a few years ago when I was on finance, and we were looking at higher income folks to their taxes are relatively lower than what middle income folks are. So the higher income folks are paying a percentage less overall. They're paying less than what middle income folks are paying. So I do think that's a really legitimate conversation to have. And I did value that conversation. To be honest with you, I don't know where it got left this year, but I know it didn't get sent forward.
Right. Well, I'm sure there will be big conversations.
Oh,
I mean,
yes.
This is a healthcare conversation right now, but there will be many conversations about revenue moving forward and into the next
It is
year.
frustrating to see. There's been a lot of chatter in the media, particularly the New York Times did a piece recently, and I know I'm going a little off script here because this is at the federal level, but the amount of the percentage of taxes that billionaires are paying, and you look at the graph and it's just this precipitous drop, and it's very disturbing. For my husband and I to be paying a higher percentage in taxes than billionaires, when, you know, school teacher and working for an airline. I mean, why we put up with that in this country is beyond is beyond my understanding. It doesn't make sense. And meanwhile, the gap between the rich and the poor will continue to grow.
And it's really fascinating that there are a number of folks in both the House and the Senate who don't understand that. But the gap is growing, and it is unfair. So that will be a great conversation going forward.
That conversation always persists. So let's move now to the opioid crisis, and let's talk a little bit about maybe H72, which is the bill that established a pilot overdose prevention center, the state's first of that kind of facility. So could one of you, either of you, talk about what you expect to come of this bill and what it will look like to establish an overdose prevention center in Vermont?
I can start, but again,
Go ahead.
the vast knowledge is to my left. Because I've gotten into a lot of this work sort of as it's already been baked over a longer period of time, but I can speak to my experience having come in not knowing a lot about OPCs, to be honest with you, and just hearing the hours and hours of testimony that we took from folks who've lost loved ones, which all over the state, every socioeconomic level, it just has touched so many people, and it was eye-opening and obviously extremely sad to hear the testimony from folks who've lost people and loved ones to opioids. And also hearing from folks like, for example, the folks up in Johnson, Jenna's Promise, who are creating a community of recovery for folks. They lost their daughter a few years back, and they have put all of their energy and focus into helping folks in recovery. So that is it just really, it gives you hope for the future. And then, of course, in Burlington, we've really seen what happens when there is this drug crisis, this epidemic. And it is, I think it's just incredibly tragic. And OPCs, we learned in committee, and we took some really, really great testimony on what it looks like in a community, how it sort of cleans up a community, how it saves lives, how, emergency room doctors really like OPCs because it means they're not taking folks in these moments of crisis. First responders, same thing. Police forces, they are all in favor of OPCs. So it was something that the more I learned, the more I just became a very enthusiastic supporter of. And of course, we also passed JRS 44, which is a resolution. And I'll just make a quick little sidestep into that, which it was a resolution that was brought to us from Senator Vyhovsky in the Senate, and it basically just declares drug overdose deaths as a public health emergency. And it's not binding in that it doesn't really create any policy, but it does sort of set a tone, and it almost gives us a vision around where we're headed when it comes to this particular epidemic. So I really appreciated that we had this resolution, and we voted unanimously on that resolution, at least in the first go-around. So yeah, I just wanted to mention that, but Senator Lyons can go into more detail.
Right, so the Overdose Prevention Center Bill, H72, ended up allowing for Burlington to have a pilot program. So it's a pilot for 5 years. Where does the money come from? The money comes from what we call the Opioid Settlement Fund. So our AG joined a lawsuit against the larger drug companies, including the Sacklers, everybody remembers that, where they encouraged the use of addictive opioids, prescription medication. So the bill itself is being funded by the results of that lawsuit. So the OPC will be funded by the results of that lawsuit. When we passed the bill, it went to appropriations, and this is a case where appropriations actually improved it and said, well, if you're going to do this for the first year, $1.1 million for the Opioid Prevention Center, then we need to say something in the big bill, in the budget, that says we anticipate funding this through the opioid settlement fund in years going forward. Oh, I think Senator Gulick has explained it really well. When we had a joint meeting with Senate Healthcare, Judiciary, and Economic Development, and we were looking at the opioid problem in conjunction with some other issues, homelessness, for example. Well, what we discovered were all the things that Senator Gulick was saying about the devastating effect on our friends and family with, contaminated drugs causing death, instant death, and the need for testing and the need for helping people have some medical care, because many people who are addicted and inject drugs have terrible sores, or they may have taken xylazine as a part of the contaminated drug, and that exacerbates those sores. So all the medical support that they can get. And then in addition, when you have an OPC, you have a link to our local recovery centers. So if someone comes in, what we found in research is if someone is associated with an overdose prevention center for a year or sometimes two, there's an increased referral to recovery. So it's somehow just being in this clinic-like environment helps them move forward. I see the recovery process as a really important prevention process. Recovery is prevention. Prevention is recovery. And so we hope, I truly hope, because I was ambivalent about this. I have to say that, as were other senators, very ambivalent about having this in our state. We heard from folks across, from Canada and folks in New York, folks in California, Rhode Island. We heard that OPCs are moving forward, that they do have benefit, and there are over 200 of these centers across the globe, some in Europe. So as I said, I was hesitant last year about this bill. This year we took testimony. It's very compelling when you hear the testimony.
Something that I don't know if either of you have followed along with the what's happened in Oregon and in Portland, where there was a very significant shift in policy, well ahead of the curve to in an effort to decriminalize and really try and point folks towards recovery services. And now it seems like there's actually sort of a swing of the pendulum in the opposite direction now, and a very progressive administration, progressive mayor, progressive governor are now swinging back towards recriminalizing these drugs. What lessons could we unpack there from our sort of peer left-leaning state over on the West Coast as far as the opioid crisis?
Don't decriminalize. Yeah, that's opioids are significant. The opioids that started this are prescription drugs. They should stay that way, and don't decriminalize the use at this point, or as you think about the distributors that we see in some of the apartment buildings in Burlington, and we need to hold them accountable. The contaminated drugs that are coming in are terrible and can cause instant death. So I think Oregon has taught us that we need to go slowly and carefully, and by having a single pilot program in the state coming up next year, maybe is sort of beginning the process in September or October, when the Department of Health puts together the guidelines. That's the right step to take. Going too fast is not the right step, and I think Oregon has demonstrated that.
Yeah, I would add that the war on drugs certainly hasn't worked. It's been around for a while, and it has not been successful. So I do think it's important that we look at other opportunities and other ways of doing things. I have followed somewhat what Portugal has done, which is they actually have decriminalized drugs there, and it's been relatively successful. I think one of the things that has come to be pretty obvious in all of this is that if you are ever going to take a step like that, you have to be prepared to invest a lot of resources into how you're going to support these folks who are, they suffer from a substance use disorder. They suffer from a disease, and it's going to require a lot of, support from people, police officers, mental health counselors, doctors. The whole system has to kind of get behind this in a way that I don't think Oregon was prepared for. And as Senator Lyons said, they probably moved too fast. But I do think there's a way to do it that it can be successful. And I hope that it's something that more countries in the world can explore.
So one other issue, one of the bills that we did pass is S-186. I started working on that last year with a group from Kentucky, the former governor of Kentucky, Dr. Fletcher, and he's an MD. But he's also been putting together some of the recovery centers and recovery residences in his state and in other states. And when Martine mentioned Jenna's Promise, so the bill that we have put forward is to look at what are the requirements, or how do we certify our recovery centers and improve the recovery system overall. I think that's a very important step. It's an early stage for that, but it will help us prevent the revolving door of recovery. It sometimes takes years. It may take 7 relapses for someone to recover, but we need to know how to prevent that. And by looking at recovery centers in depth, we may be able to get there.
Well, let's shift now to a related topic, very related, which is housing, and specifically emergency housing. So there was significant funding during the pandemic to support expanded emergency temporary shelter, and now that that's gone, it seems like a really difficult issue to try and support the folks that now are relying on emergency temporary shelter. So I think the question, there was a bill that then was built into the budget, it sounds like, but I think the question here that folks are trying to wrap their head around is, will there be evictions this year from the motels and hotels that are currently supporting folks that are relying on emergency housing, and what does that mean for our communities, for those families, and for our state?
Yeah, again, I think my colleague has a greater knowledge than I do, but I will just say that there are countries in the world where you just provide housing for people. Like, it's just everyone has a place to live, and it turns out that ultimately, although that seems like a very expensive proposition, in the long run, it saves money, because you've got folks who have a roof over their head. And we know that it's hard for people to function in our society if they don't have housing. It is such a basic necessity. And when we're looking at the greater picture of labor force and folks, and we don't have enough folks working in this state. Well, you can't work when you don't have a place to live. And we learned from a lot of the testimony that we took that there's so many folks who live on very, very, very slim margins. They're one paycheck away from losing their home, losing their car. And I think the pandemic was really that straw that broke that camel's back, and really put vulnerable folks in positions where they literally lost everything that was kind of keeping them, together and allowing them to work. So it's been really important work. We certainly did not solve the problem by any means, but hopefully we have come to a place where we will provide some help and some support to folks who are in the greatest need. And I'll let you
Yeah,
get.
I think you've expressed it very well. You know, we had a lot of federal dollars, ARPA dollars coming in during the pandemic that enabled us to support people in hotels and motels. Now we don't have that money. So how much can we afford? But the problem is that at the same time that we've lost the federal dollars, we've also seen this terrible increase in inflationary costs. So, and we've seen huge pressures in our housing and rental environment. So people can't afford. They just can't afford to rent. They can't afford to purchase a house. We've seen pressures coming from people moving into the state and increasing the cost of single-family homes, you know, where you might be able to have purchased one 5 years ago for $200,000. Today, it's $500,000. And people who are working 2 and 3 jobs aren't able to do that. They just can't. So I want to say something up front about the folks who are homeless. There's this misperception that they are somehow criminals, somehow addicted criminals with substance use disorder, and people who are irresponsible. And I think we need to take that stigma away, because the people that we were hearing from in our committee and other committees in the House and the Senate, these are hardworking people. They're going to their jobs. They're trying to make ends meet. They have kids at school. They're living some of them were living in their car. Some of them are living in motels and trying to, with 2 families in cramped quarters. And then we also know about other vulnerable adults who have chronic illnesses or are disabled. So all of that piles on. We can't ignore the needs of those people at all. So when we passed the bill out of Senate Health and Welfare, we included a 60-day period for support for hotels and motels, and then also winter shelter, which was with a cap off. But for the general assistance of the housing program, we passed, I think we had 1,500 people in, I remember exactly. But when it got to the appropriations, that's where everything came together. So the governor's proposal was allow people to be in motels for 28 days and limit it to a lower number. And the House wanted to have it be 80 days with a much higher number. So you can see, if we had just passed those bills, we wouldn't have had anything. Had to go to appropriations for a discussion. What has come out in the budget is to allow for 1,100 hotel rooms to help people, to allow for them to stay for 80 days. And in winter months, just take the cap off and allow people to stay when the weather is when it's adverse weather. So I feel good about the results of what we did. As it compares with the administration's recommendation, I think it's really very helpful. But the combination of having a housing bill, maybe we can find some affordable housing. We also invested in the budget, I believe it was $10 million for new shelters, so to get people off the streets and into some temporary living situations, so that they have some reasonable sense of being human. The bill that we sent out of Health and Welfare mixed in with the bill with the governor's proposal was a long, powerful discussion, and I'm feeling that we've done a fairly good job for folks.
We've got just a few minutes left here. An hour has just flown by, as it always does, but I just want to create some space for anything that we might have missed here in the last few minutes that you all have worked on. I know you've been super busy this session.
I do want to say final point on the homelessness piece is that it's important for folks to realize one of the data points that we heard in committee is that homeless folks are twice as likely to be victims of crime as opposed to them actually being perpetrators. We often don't understand that. I think it's really important for folks to realize that. The only other thing that I wanted to mention, because we were earlier talking a little bit about, I mean, all of it, right? We've decriminalization and mental health and all of these things. But we did pass in the Senate S-114, which is a psychedelic therapy working group. And that has been sort of a fascinating process for me in that I really got to learn how psychedelics can help folks with PTSD, depression, anxiety, in the proper environment with a professional who can assist. They can be extremely helpful to folks. So this group, there's no decriminalization in it, but it does put together a group of very passionate folks who are going to work on what this might look like in the future for folks here in Vermont. So I look forward to seeing what they come up with and what their findings are, and we'll revisit it again next year.
Awesome. I think that's as much time as we have. So thank you both so much, Senator Lyons and Senator Gulick, for coming in and speaking with us.
Can I just say one
Go for
last?
it. Yep.
There's one really important bill we didn't talk about, and that's the Child Abuse and Neglect Registry. That we improve the system for folks so that it's a fairer system when people are reported for abuse and neglect, allowing for an appeals process that today is problematic. So I feel really good about that bill.
Yes.
And I could tell that Senator Gulick does too. And then the other thing is we worked hard to help our EMS folks with a lot of different things. So there's a lot of work that we've done. And I would just want to thank you for giving us time to talk with you.
Of course.
Very
It's
much.
such a privilege to hear from both of you the work that you've been doing. So thank you for your service and for sharing your work with us. Appreciate it.
Thank you.
Thank you for tuning into Town Meeting TV's Under the Dome. You can find this episode and many more on cctv.org. And we'll have a few more episodes left this session to wrap up. And that's all for now. Thanks so much. So long.